I'd like to start by thanking you and welcoming you here to learn all about pelvic floor health. I encourage you to jot down any notes, any questions that you have as I go through the presentation, and I will have a Q&A at the end that I will do my best to answer your questions. So I am going to jump into a slide presentation, and we'll get going with that here. Easier for you to follow along when I've got slides that you can watch, and you can jot down notes for any of the details that you want to look at later. All right, so basically you are here to learn about core confidence and pelvic floor health. So I appreciate you being here and taking an invested interest in your health. My name is Christy Ware, and I'm going to be doing the entire presentation today. Let's go on here. So today's agenda, I'm going to be covering 4 main points. And first of all, I'm going to talk to you about some acronyms that you should know. Sorry, not acronyms. Some of them are acronyms, but also terms and definitions that you should know. The terms diastasis recti, also known as abdominal separation, organ prolapse, and incontinence, and how to know if you have them. The second one being what causes pelvic floor dysfunction. There are several different causes, and I'm going to go over each of them for you. And then number 3 is why starting back to exercise slowly, retraining your pelvic floor and doing some very specific exercises will make all the difference in your recovery postpartum. And then I'm going to end with 3 exercises that you can do today. I'm going to walk you through them, and you'll be able to start doing them right away. So let's get into it. So before I get too far, I want to tell you a little bit about myself. As you can see by the photos, I am an energetic mom. Our son calls me Mimi. We decided before his birth that mom and mom wasn't going to work well, so we came up with another name, and Mimi means beloved, and it seemed to fit, and he still calls me that. He's 3.5, and I am Mimi. That's what I am to him. So that's the little tidbit about me that makes me unique. I love dark chocolate, I love blue rodeo, and I love anything outdoors, as you can see by the pictures. I played baseball since I was 4 and just been on sports teams and been active my entire life. What brought me to this particular topic and this, this idea of studying, pelvic floor was a few years back. I suffered from a major back injury. I had 2 slip discs in my back. And at that time, I would have considered myself as fit as I possibly could have been in my life. One of the fittest times that I've been. And the back injury really derailed me in terms of, oh my goodness, will I ever play sports again? Will I ever do the things that I did in the past? And I was laid up for about 1.5 years, a lot of pain, a lot of discomfort, and I was really, really scared. And not knowing how to properly care for my back, not knowing the importance of core stability and core strength, that is why I got injured. And so I took a vested interest in, really diving into this topic and learning more about how to really take care of my body beyond traditional crunches. So that's what I'm all about here. And who am I and why am I qualified to be here today? I must be a question you might be asking yourself. I've been fitness training for the last 10 years. So I've got certifications in various different areas. And most recently, I have certified as a core confidence specialist, which is pelvic floor health, taking care of moms pre, during, and postnatal. And I've got a few other certifications that I've taken along the way, but the core confidence, working primarily with women and working with moms, I wanted to really ensure that I'm taking the best care of them that I can. And so this course really lends itself to that. So that's my background in courses. So before I get into this particular slide, I just wanted to say that, being a mom, you're pregnant and, everyone's coming up to you saying, wow, you look amazing, you're beautiful, and you're glowing and all these different things. And, that's great. And then the baby's born and it's not about mom so much anymore. The transitions to being more about the baby. And, people are, not understanding the magnitude of the emotional, the physical, all the things that happen to you after giving birth, and suddenly your self-care isn't, the primary focus anymore. It's all about the baby. And as much as that's important, I really encourage you after, listening to my webinar to understand the importance of taking care of yourself and knowing that, and knowing just how important that is, and really taking charge of that, taking back your power. And yeah, so I'll carry on here. So first slide here is about the core 4. And what this is referring to is the 4 muscles that essentially make up our core, and they keep us stable, as you see the different things that the core muscles do. So the 4 muscles, the first one being the multifidus, and it's a muscle that runs down the spine, and at the bottom of the spine, it fans out into what they would look like a tree if you looked at it from the back. The next muscle is the diaphragm, which is obviously the muscle, the band of muscle that pushes up and down as we inhale and exhale. Then we've got the pelvic floor muscles, which are at the base of the pelvis, and they support the pelvic floor organs. We have a sphincteric action, which helps with continence. And then we have the subpump action that, again, through the diaphragm, respiration, and then it also plays a sexual role. So the 4 muscles that I'm referring to when I'm talking about core stabilization are these 4 muscles here. So you can always refer back to those. And moving on, so first definition that I want you to know about, and again, all of these definitions that I'm sharing with you, any of this information is coming from a place of educating you. I don't want to be instilling any fear. It's just when we have knowledge, we have power. So we can make better decisions and we can better care for ourselves, right? So diastasis recti is again known as abdominal separation. It can occur in various different ways. As you can see in the slide there, it can occur in different areas of the abdomen. And essentially what happens is when we have a baby, the baby grows and it pushes the stomach muscles out, and the muscles, they open up. And when that's a totally natural thing that happens, but after the baby is born, what happens is a lot of the muscle tissue doesn't actually come back together and link together. So now we have an opening in our abdomen, and depending on your body, you know, the type of birth that you had, the size of the baby, all these different things, genetic factors, some people will have a very small separation and some people can have a very large separation. And so the main thing to focus on here isn't necessarily about how big your separation is, but more importantly on whether or not your pelvic floor can still function with this separation. So that's what we're really looking at here. And the connective tissue being separated, you know, it leaves us essentially a hole, or that poochy mommy tummy that they talk about when you go to sit up and your tummy kind of puffs out. That's a big indicator for this one. So those are the kinds of things we'd be looking for with diastasis recti. So the next definition is organ prolapse. And organ prolapse isn't talked about as much in new moms. Yes, it can happen, but generally it happens later during menopause is when a lot of women will see organ prolapse start to occur. And anything that can drop out of our bodies, sadly being women, it just predisposes us to gravity pulling down, and things can essentially, you know, drop out of the vagina. So things like your bladder, your uterus, small intestine, you know, vagina and rectum can all prolapse. So later in life, when you're entering into menopause and your hormones are changing and the elasticity in your body is changing, that's when we see a lot of organ prolapse occurring. So just really important things to note, the varying degrees of it. So somebody may have a level 1 first degree prolapse where they barely notice anything, but they feel there's something there, and then it can go all the way to the 5th degree where there's an actual organ falling out of the body. So that can be in varying different stages. It's not always, you know, black and white. You might not know you even have it. So that's another thing to take note with the organ prolapse. So I'm going to move on now to the third term, and that's incontinence. So anytime you are peeing when you're not trying to go pee, it means you have an incontinence dysfunction. So times that often women will notice it postpartum is when they sneeze, when they cough, when they laugh, or when they go to jump or run after their child. Suddenly they're going, oh my goodness, I'm peeing. This is not normal. This needs to be cared for, and you need to retrain the body so that it does not pee when you're not trying to pee. We don't want that carrying on throughout life. Common causes of incontinence, as I've got the list here, you know, childbirth being the biggest one, lengthy pushing times. As you can imagine, you're putting a lot of pressure on your pelvic floor, a lot of pressure on your bladder. So it's, you know, the bearing down, nerve damage, menopause, as I mentioned, chronic coughing. Posture is a big one where you spend a lot of time now sitting at computers, and we've got this forward head posture, and it's leading to incontinence problems. Certain foods, as well as lifestyle and age, are all factors for incontinence. And when I'm talking about postpartum, it's generally stress incontinence that happens, right? Stressful events like jumping and doing exercises or coughing and laughing that put pressure on the pelvic floor, and the muscles aren't strong enough, so we pee. So those are the three terms that I wanted you to know about. And also you're wondering now, how do I know if I have these dysfunctions? Like what would be telling me? As for the first one, the diastasis recti, the easiest and most effective way for you to know is if you see a pelvic floor physiotherapist or someone like myself who is trained in core competence, meaning that we can do tests on you to determine if you have a separation and how big it is and what we need to do to then correct that separation. So honestly, seeing the pelvic floor physio within the first few weeks postpartum is going to be the best thing that you can do, providing you're healed, the best thing you can do for your body so that you're aware. And please don't wait. If you think, you're 6 months out of childbirth, you're 6 years out of childbirth, it's still okay to go and have this test done. And a pelvic floor physio can see you up until you're, 80, if it's something that you need. And then a side note on this I wanted to share is that this doesn't just relate to postpartum moms, and it's not just for moms. Other people, men, babies, we can all have pelvic floor dysfunction. So, make sure that you're aware of that too. It doesn't just relate to pelvic floor dysfunction in moms. It can relate to pelvic floor dysfunction in anybody. Okay, so how do I know if I have an organ prolapse? Well, as I mentioned, this is really common, but some people might not even know that they have it. And ways that you can tell is if you have a bearing like pressure in your pelvic region, if the feeling is actually something that is falling out of your body. Obviously, that's another one. If something's falling out, you're obviously, you're going to know about that. Pain during intercourse is another big one, and low back pain. A low back ache is what I often see with a lot of the clients that I work with. They complain of that low back pain. And so immediately I start asking them questions, and soon I'm kind of self-diagnosing, saying, you need to go see a pelvic floor physio, and we're going to look at this a little further. So low back pain is something to note, especially if you've had children. Okay, so how do I know if I have incontinence? Well, this is probably the easiest one to diagnose, because if you're peeing when you don't want to pee, you've got incontinence. So that's probably the easiest one to diagnose for yourself. And again, knowing how to retrain your body so that you're doing the best thing for your body to regain strength, so that the pelvic floor is working and you aren't peeing when you don't want to pee. Okay, so moving on here to the main causes of pelvic floor dysfunction. So as I said, there are several causes. Pregnancy is the main one that I'm focused on, and it is the main cause. Then we're going into childbirth. So again, depending on how you birth, cesarean births don't mean that you are, immune to any of these dysfunctions. Cesarean birth can be absolutely can still have dysfunction, can still have diastasis, can still have incontinence. These things can still happen. Poor posture, again, I mentioned that before. When we're sitting poorly and our pelvis isn't sitting in a good, postural position for long periods of time, we get pelvic floor dysfunction. We're seeing it more and more. Another one is hormones. Of course, as we're, going through life, our hormones are changing and fluctuating. We get more pelvic floor dysfunction because of that simple fact that the body is changing and things are getting, not enough elasticity to hold things in place where they were before. Previous injuries is another one. If you're predisposed to either a pelvic injury from, younger when you were a young child, or maybe you have a back injury and then now it's leading to a pelvic floor dysfunction. And so in my case, as I talked about at the beginning of the webinar, my back injury, I'm sure, was somewhat related to the fact that I had a weak pelvic floor to begin with, and now I'm doing all this physical activity and not taking care of myself in the way that I needed to. Hadn't done a Kegel in my entire life, didn't really know about it or what I needed to do, and then suddenly I'm injured. And so another thing to really note. And then the last one, returning to high impact exercise too soon after having children. Really big one, really important one, and something that is part of the mission in the business that I run and the clients that I work with, is really making things safe, effective, retraining their body before I get them into anything high impact to really optimize their recovery and postpartum care. So that's what I'm focused on here. So again, on that, returning safely and effectively to exercise. The three main things I want you to take away here is not to engage in high impact exercise too soon after having given birth. And again, everybody's body is different. So what might be okay for your friend might not be okay for you. So it's really a personal thing. And I think that, general rule of thumb, 8 weeks postpartum, you can start to get back into activity. the program that I have trained through, they actually have us working with clients first week out of birth. We have you doing a series of exercises for week 1 to week 8 that retrain your body, and by 8 weeks you're strong enough to start doing exercise pretty well regularly unless you have major dysfunction. So that's really good to know. You can start doing stuff right away. You just need to know what those things are. Second one, focus on retraining the pelvic floor, strengthening the core, back, legs, the areas of the body that got, more weakened based on the fact that you were carrying more weight. Your posture changed during pregnancy. So all these things, you want to be able to, use specific movements that support your pelvic floor and the surrounding muscles to ensure that you are, your body's going to function well and you can carry on doing activities you did before having kids. And the third one, making healing and recovery your main focus, regardless of how many years out of birth you are. It's never too late to start retraining. So whether you've had a child, 2 months ago or you've had a child 10 years ago, it's worth it. It's worth it to start retraining now so that, you live a healthy life, moving on into your elder years. So I want to teach you 3 exercises today. These are the takeaways that I wanted to give you. So the 3 exercises that I'm going to go through, here's the first one, and it is called the core breath. And I'd like all of you to try to go through it with me, all of you that are on here live. If you can position yourself on a flat surface, as you can see in the image, she's sitting on the edge of a flat chair. Or if you have an exercise ball, that works too. I prefer the exercise ball myself, but it's totally up to you wherever you're at today. And what I'm going to get you to do is you come to the edge of the chair. You're going to think that there's a string pulling out the top of your head, and it's keeping you nice and straight, so your posture is nice and tall. Your chest is open. And what I want you to focus on is putting your perineum. For those of you who don't know the perineum, if you've had children, you should probably know this, but in case you don't, it is the muscle, the tissues that are the flat tissue that run between the anus and the vagina. So you're sitting the perineum flat on that surface. Once you've got yourself in the position, you're going to take a deep breath in through your nose. And as you take a breath in, you should feel your abdomen and your ribs expanding. And this is for pre, during, and postnatal moms. So all of you can try this. So we're taking a deep breath in through the nose, letting everything expand. And now what I'm going to get you to do is engage your Kegel muscles and think about picking up a blueberry off that chair or off that surface so slightly that you don't squeeze it, and you're going to pull it inside, and you're going to purse your lips and blow out the air. And that would be considered one core breath. And what this is doing is retraining your pelvic floor and sending the signal through that, hey, we should come on every time we breathe, every time we do something and I pick up something heavy or I move in a certain way and lift my child. Those pelvic floor muscles need to come on automatically. They should come on automatically. When we have a dysfunction, they don't come on automatically. And so this is where we're dealing with, we need to retrain that. We need to send that neural pathway, retrain it through again to be able to come on when it needs to do it. So let's try the core breath one more time, just to make sure everyone's got it. So we're going to breathe in through our nose. Feel everything expand. You're going to pick up your blueberry. Feel that Kegel engage. Breathe out the air, and you should feel your abdomen contract and pull everything in as that breath comes out. So I hope that was helpful for all of you, that description. There are many cues to teach the core breath, and I do work with moms and teach a variety of cues. Not everyone works with, everyone likes the blueberry. Some people like other cues, but for today, that will get you going on the core breath. And this can be done 5, 6, 10 times a day. You can do this every day and start strengthening your pelvic floor. Okay, so the next one I'm going to show you here is the squat. So squats are great for your glutes, for the bum, for the quads, the fronts of the legs, the hamstrings, back of the legs, and also for working on posture. So when we do a squat, you can see in my description here what I want you to focus on for yourself. It gives you a description of exactly how I want to do a squat. But for everyone, their hips can be a little bit in a different alignment. So you might not want to stand just as I've mentioned. You may want to stand with your toes or your feet closer together, shoulder width apart, toes facing forward. If that feels comfortable for you, that's a great position to start. If your hips are feeling uncomfortable when you squat down, opening your legs and turning out your feet is also totally okay. Okay, there's not a right or wrong to this. It's whatever feels good for you. And what you're going to focus on is going down nice and slow. and coming back up with a count of 2 seconds down to 2 seconds up. And you're wanting to ensure that your knees never come past your toes and that your bum, your tailbone is poking out the back as if you're sitting on the edge of a seat. Okay, so that's how a squat is performed. And so those ones, again, this could be done 3 days a week, 15 repetitions, a couple times a day, wherever you can fit it in. And the third exercise I want to show you is the hamstring bridge, or sometimes known as the glute bridge. And with this one, you're lying on your back. And essentially what you're going to focus on is we're bringing in the low back, the glutes again, so the bum and the hamstrings are the main focus of this exercise. So you're going to lie on your back, your feet can be right tucked in close to your bum, and as you lift, you're keeping your pelvis nice and flat, so it's aiming towards the ceiling, relaxing your upper body. You're holding for a couple of seconds on the up phase, and you're lowering your body back down. The alternative is if you're trying to engage your hamstrings, which are the backs of your legs, then your feet would move out just a little bit further. Okay, so hopefully that makes sense to all of you. Either the feet are tucked in for the glutes, or the feet are pushed out and you're going to engage the hamstrings. And again, slow and controlled, up and down, will have you strengthening those areas that need it most. So with those 3 exercises, those are your takeaways for today. And your next step is to purchase my Postpartum Core Strengthening ebook. My Core Strengthening ebook contains the 3 exercises I just taught you today, as well as 9 more exercises that I've packaged into an awesome video that you can follow along with. I've got nutrition information, recipes, self-care tips for postpartum moms. It's all there. There's also progressions for if you get really good at those exercises and you want to make them a little harder. I've given a progression and a printable PDF program for you to follow. It's jam-packed with lots of goodies. It's $15 for the next 24 hours, and it'll be in the email that you'll be receiving later today with the video. And for those of you who are catching this on YouTube, it's in the link below the video here, or in the email that you got. So yeah, that's the ebook. If you are looking to eliminate back, hip, or pelvic pain, if you're peeing when you don't want to pee, and if you're really just looking to get your pre-baby body back and start doing the things that you love, this ebook will get you on track to be doing that. I've had clients who have worked with me, and within a month of following this program have seen a drastic increase in their core strength, but also they're not peeing anymore. They've got less pain. They're just feeling better and stable overall. And that is the best thing, the most rewarding part of what I do here, is to get to moms feeling good. And your pelvic floor thanks you in advance for taking the next step in your health and taking care of your pelvic floor. So thank you so much for being here and listening to this webinar. I'm going to pop over and I'm going to drop the slides here, and I will pop over and do a Q&A. So if any of you have questions that you've written down throughout the presentation, I'm going to jump over and answer those for you right now. So I'm going to unmute everybody and see what we've got. All right, I've got a few people on. If there's anything that you'd like to throw into the chat bar, you can do that, or you can we can unmute you and we can let them talk. So are we unmuted here? You can unmute yourself if you're on mute right now and you'd like to ask any questions or any comments at all. You can unmute yourself, and please do jump in. Okay, so I just realized that I've got a question here through Messenger from someone. I'm just wanting to learn how I can fix and strengthen my bladder issues. Okay, so this is a really big one for a lot of people. It's actually more common than you know, and people don't often either talk about it, or if they do talk about it, they're kind of shy and they say, oh, but it's totally normal. Everyone pees after they've had children, right? So that's the consensus between a lot of groups of people, a lot of moms. Everyone gets that. Honestly, the core breath that I taught in the video here is going to be the first step to retraining your pelvic floor. When the sphincteric action of the bladder and the pelvic floor isn't working as well, so after you've bared down, you've had children, these different things are happening, maybe you've had some scarring, some tears. When it's not functioning well, that's when we get the urinary incontinence. Excuse me. So actually retraining the body through the pelvic floor, through the core the core breath muscles, that's where you're going to start with the urinary incontinence. So you're going to start with that, and that's one of the people that I said to you, one of the clients, within 4 weeks of following my program, she was already feeling better, and her urinary incontinence had actually completely disappeared. So it can happen. It can happen in varying degrees. It might take a little longer, but keep at it. Keep at it. Don't give up on it. Some people had some technical difficulties. Okay, they got on. Great info. You mentioned Kegels. How soon postpartum can you start? Okay, great question. So we're talking about Kegels here. Again, the core breath, every time you do that core breath, you're going to engage a Kegel, and that should be done immediately after you've had children. It should actually be done before you have a baby. You could be doing it 9 months leading up to the birth. This is one of those things where if you train your body pre-birth, your body already knows what it needs to do after you've given birth and been through this amazing experience. It knows what to do. So Kegels are definitely a part of it. It's not talked about as being the only thing. We do the whole breathing exercise with the Kegels as opposed to just engaging Kegels for a couple of different reasons. We want to include the diaphragm. You want to sit with proper posture. You want to be doing these things as well as engaging a Kegel. And interestingly enough, there's some women who actually have a really tight pelvic floor, and they can't release it. So if I have them doing more Kegel work, it's actually not very good for them because they wouldn't want to keep tightening it. They actually need to do some release work. So Kegels aren't something we give to everyone, but it's definitely something that we should know about and we should know how to do. So we've got so I've got another question here. So being pregnant with twins, is there a timeline that's safe after multiple births, or do you wait longer? Again, it's really about your body. And again, the core breath can be done at any time. If you're already physically active leading up to having a baby or having babies in some cases, your body would be able to bounce back fairly quickly. If you're somebody who has been more sedentary, that in and of itself, retraining the body first through the core breathing, through the hamstring bridges, the squats, doing those things properly will be your best bet to getting on the road to recovery. So I've got another question. Also wanted to start a yoga practice postpartum with my postpartum crazy flexible body. My chiropractor wanted me to work on my core first to avoid injury. Any thoughts? I totally agree. There's yoga is great, and there's some, there's actually some videos out there that are specific to mom and baby and that kind of thing, and they do specific poses that are really good for postpartum. So although I'm not I don't do yoga as a regular practice. I love it. I just don't do it regularly. I do know how it works, and I know the premise behind it. And I think if you're following a sound program and you've got advice from your chiropractor, from your midwife, whoever it is, that they've given you the okay to do it, then I think it's probably okay. And again, it's going to depend on the body. If somebody's really overly flexible, maybe they still got a lot of relaxant in their body, and they go jump into yoga, especially something like hot yoga, they might actually do more damage than good. So there might be a reason that your chiropractor is saying to wait. Not totally sure on that, but you'd want to definitely be sure there's a reason behind the reason that they're telling you that. You want to know what that is before you jump into anything. So I hope that answers everyone's questions for today. If you have anything more that you'd like to ask, you can find me at Strength and Soul Wellness. My email is christy@strengthandsoulwellness.com. And I hope you enjoyed the webinar today. And thank you again so much for being here. And I hope you enjoy the ebook. Take care.